Hi, Mr. G.
Hi.
Hi, my name's Mike. I'm an occupational therapist.
Okay, you're Mike. How are you?
Very good. How are you?
I'm good, How are you?
I'm going to be working with you on your case.
Okay.
And I figured we'd use today's session to go over Medicare. I know you and your family are asking questions about it. Okay. Well, I just found out, so looking at your file, you just recently turned 65 and are enrolled in Medicare. Do you have any questions about your recent hospital visit and how Medicare fits into that?
Since I've been here, I've not been at home, so I don't know what to expect.
You haven't been home, and you haven't seen the bill. Okay. Well, as I see by your file, you've been in the hospital for 3 days following a fall. A typical Medicare patient being hospitalized will pay $1,184 and no copay for hospital insurance, as long as you're at the hospital for less than 60 days. Now, as I'm reading in your file, you're going to be going to a rehabilitation center. Do you have any questions about going to the rehabilitation center for OT services?
I don't know. Are you saying I'll be receiving OT services
Yep.
in the rehabilitation?
Yeah, you'll be receiving OT services in a rehabilitation center.
So how much will I be expected to pay?
Okay, how much, and that's a good question. That's where Medicare Part B comes in.
Okay.
You will first pay a deductible of $147, and Medicare Part B will pay up to $1,900 of occupational therapy. Okay. But you are still liable for paying 20% of the total therapy cost. For instance, after you pay your deductible, say your OT bill was $1,000, you'd be responsible for $200 of that, and Medicare would get the rest, $800.
Okay.
Medicare Part B, that is.
Okay, that sounds pretty reasonable. What about my teeth? Dentures? My teeth are falling out?
Dentures. Your teeth are falling out. Okay. Well, unfortunately, Medicare Part A and B do not cover such things as dentures, routine dental work, eye care, cosmetic surgery, acupuncture, and hearing aids.
Okay. What about the walker?
Walker.
You need one?
You're going to need a walker.
Okay.
And actually, Medicare will pay for 80% of the costs of durable medical equipment, such as walkers, wheelchairs, oxygen tanks, and the supplies.
Okay. Well, what about the pain medicine? Doctors said I'll be on pain medicine for some time.
Yeah, pain medicine. So if you're taking medication, that's where Medicare Part D comes in. That's prescription drug coverage.
Sure.
Do you remember signing up for that when you enrolled in Medicare?
I don't know. You know, these are whole brain. I don't know.
The brain ain't what it used to be, huh?
Yeah.
Okay, well, it is very good if you did. People should sign up for Medicare Part D even if they don't currently take medication, because there's a late enrollment penalty if you don't. Now, the amount that Part D pays is based upon your yearly income and may include a yearly deductible and or a copay.
What about the damn Obamacare? Would that affect my Medicare?
Obamacare, yeah. With the Affordable Care Act, Medicare Part D covers more for prescription drugs, specifically brand name drugs, in order to cover the donut hole, as they have termed the gap in coverage later in the year for prescription drugs. It also makes Medicare cover medication counseling, depression screenings, counseling for alcohol misuse and or obesity, and behavior therapy. Co-payments are removed from preventative care, such as cancer screenings, immunizations, mammograms, as well as colonoscopies.
I'm not taking any colonoscopy again?
No more colonoscopies?
No,
okay.
No. I've heard about Medicare Part A, D, A, B, D. What about Part C?
Part C, that's a good question. Medicare C is called Medicare Advantage. It's run not by the federal government, but by private companies approved by Medicare. It combines Part A and B, and most include Part D, the prescription drug coverage. Now, many Medicare Advantage packages offer extra coverage like vision, hearing, health and wellness programs, and even dental. This could cover your dentures if you wanted to apply for Medicare Part C. But not all doctors are covered under Medicare Advantage, but it is worth looking into. It could save you a lot more money, but you have to weigh what the package offers and what it doesn't. Medicare Advantage does have to follow all the rules that Medicare has, and you will not pay more for such things as chemotherapy, dialysis, and skilled nursing facility care.
You really know your stuff, Mike.
Oh, thank you.
Is there any other thing that can save me some bucks?
All right, anything to save you some bucks. Well, if you get into a Medicare certified home health agency for your OT services, so if you have OT services in the home, Medicare will pay for 100% instead of 80%. And also, a new class action lawsuit last month changed the rules for Medicare. Coverage for therapy cannot be denied to you through Medicare if you reach a plateau in your therapy or your condition doesn't improve any better. Now, that doesn't mean I'm not going to work hard to get you back to being independent as possible and back to your job as manager of Abby's Sausage Company.
I can't wait to go back.
I'm looking forward to working with you. We'll get you right back.
I'm counting on you, Mike. Thank you very much.
You're welcome.
Thank you.